speaker for today is Mrunmayi Adawadkar, who's going to be discussing the different types of therapies such as CBT, BT, and more. Mrunmayi is a senior consultant psychologist at InnerHour who has worked extensively with clients struggling with grief, trauma, cancer, and their caregivers and children.
I'm doing good. So today I'm going to be talking about different kinds of therapies, and although it's a vast, huge topic, it's not possible to cover everything today. But what I want to do, or what my goal is, to just give a glimpse of what all exists out there. This is by no means an exhaustive list of therapies. So if you guys have any kind of questions, clarifications, please do ask away, and let's start. So before we begin, I just want to give this a disclaimer that whatever I'm going to be speaking is it can be considered as a general guideline, and it is a supplement. It can be considered as a supplement for your personal self improvement, right? This is not intended to be a substitute or to replace the treatment, the diagnosis, or the advice from any kind of qualified licensed mental health professional. And this goes without saying that please always consult a qualified and a licensed clinical professional, be it for diagnosis, be it for treatment, right? Self diagnosis is a big no no, so please don't fall into that trap. And let's get started. I just want to put these statistics out first before we move to the therapy part. Why are we talking about therapies, and how does this tie up in the bigger picture, right? So in the last 20 years, psychosocial problems in children, among children, have gone from 7% to 18%. We all know that 4 in 20 people are diagnosed with depression, with clinical depression. And in adolescents, concerns such as anxiety, mood, attention, and behavior disorders are on the rise. And especially in the last 1 year, all these things have been exacerbated. Children, adolescents who have not faced any of this earlier are also struggling with this, as are adults. And suicide is the third leading cause of death in older adolescents between the age groups of 15 and 19. And, like previous speakers have said, the causes are numerous. It's a complex case. It's not as straightforward as we would like it to believe. So, how does psychotherapy play a part in any of this? What is psychotherapy, right? We all have heard these memes. We've all seen these memes, heard it from other people. That I can always go and talk to a friend. Why do I need to go and see a therapist? Which is true. You can always go and talk to a friend, but why do we need therapy? Because therapy is a conversation. It's talk therapy between someone who makes a space for you that is safe, that is non-judgmental, that is unconditional, right? And it is an interaction with the child, with the adolescent, with the adult, or in also some situations with the family. The whole point of therapy is to understand your problems, is to resolve your problems as best as possible, to modify behaviors, to modify thoughts, to accept your feelings, to accept your emotions. And all of this then translates into some sort of a positive change in life. The way I see therapy working is first to create insight. What is that I'm going through, and then how do I use this insight to bring about change? So this is again in a nutshell about therapy. Let's move on to some types of therapies. And like I said, this is not an exhaustive list, but these are the few things that I would like to touch upon today. These sort of make the foundation for the newer therapies that have come along. So let's get into it. First, psychodynamic therapy. Everything begins with Freud, and psychodynamic has its origin in the Freudian psychoanalysis, the classical psychoanalysis. Although no one practices it as Freud had intended to, people have modified it, and the elements, the essence is retained, but maybe the approach and the therapeutic intervention is then different. What is psychodynamic therapy, right? What does it mean? It means that the therapist will consider your emotional distress as a result of something that is ongoing for you internally. So there is an internal psychic conflict, and the manifestation of it is in terms of emotional distress. Here, what happens with an individual is that if there are emotions that are overwhelming, disturbing, you keep them out of awareness on purpose. It serves a self preservation mechanism. So the therapist use strategies like working through the transference, uses some sort of dream analysis, free association, and so on, to bring all of these thoughts, these unconscious motives into the awareness, and then work with it. So when we attempt to cope with the with the psychic distress, the symptoms invariably go down. And again, like I said, the symptom is a manifestation of something that is happening internally, right? So you're not just treating the symptom, but you're also treating what has happened with you at a psychic level. As goes with all the therapists, it's a non-judgmental and understanding environment. And in the process, you also realize that you need to label some of the emotions that are expressed to better understand that. One thing that has come up consistently in research is that children often worry about burdening their parents, burdening their caregivers with strong feelings, right? And for them, it is sort of reassuring to know that a therapist is someone who can take that load, and not become distressed by it, right? Or who can take that load and not say things like, oh, but you're too young, you shouldn't be feeling this way, or whatever. So psychodynamic therapy does work well with children as well. Of course, with older children and with younger children, there are just different mechanisms as to how you work with them in a psychodynamic therapeutic approach. Moving on to something that has become a very common term used, especially in the last 1 year, is cognitive behavioral therapy. And what is that? So it involves examining my distorted patterns of thinking, my cognitive errors. It also teaches me how my thoughts, feelings, and behavior interact with each other, right? And how this then influences my actions. So, as a part of the therapeutic process, I learned to identify these harmful thought patterns, or these maladaptive thought patterns, and then with the help of a therapist, I attempt to replace with this something more appropriate. And when I change my thought pattern, it also translates into change in my feelings, which invariably will change how I act in a certain situation. So some common strategies that we use in CBT is tolerating painful emotions, cognitive restructuring, where you ask questions like, whatever you're thinking, is there evidence to it? Is it 100% true? Is there an alternative explanation for this? So forth and so on. Role play also plays a big chunk in this, because when you're role playing, you're trying to understand what the obstacles could be, and if there is, how can I get around those obstacles. CBT has gone through rigorous research methodologies to prove that it is effective in treating a large chunk of conditions, including depression, anxiety, eating behavior, behavioral concerns. But it has also proved very beneficial in trauma as well, right? There's a whole separate module. There's a whole separate module for people who are dealing with chronic pain, and how CBT can be useful there. Let's move on to something that has emerged from CBT, which is mindfulness-based cognitive therapy. Right? What we are trying to do here is we are trying to take some elements from CBT and some elements from mindfulness meditation. The mindfulness meditation here looks a lot what Buddhist philosophy teaches us. So the whole idea is to change my relationship with the thoughts and feelings that I find overwhelming or distressing, right? So I'm not trying to change anything here. I'm just trying to say, okay, this is what I'm feeling, this is what I'm going through. Let me sit with it and let me try to accept it as it is, right? So here your actions are purposeful. You're making an effort to bring those thoughts and feelings into awareness. You're very much into the present moment. You're not running into your future, or you're not going back to your past, but you're very much grounded in the present moment. And of course, there's a non-judgmental stance towards yourself and towards also your thoughts. So if I'm having this thought that, oh, I would want to go and kill someone, or something like that, I'm not judging myself for having such a vile thought, but I'm accepting it ki this is what is happening. It's proved to be a very powerful tool in prevention, of a relapse in depression, and also the after effects of trauma. So it almost works like a barrier, like a buffer between relapse. some obvious strategies that we use in mindfulness, cognitive behavior therapy is body scan exercise. We're just aware where you're holding the tension in your body, how do you go into a state of tension, and then how you experience that state of relaxation. A very famous exercise in the mindfulness CBT is eating a raisin with awareness, right? And we do variations with this. We do eating a chocolate with awareness. So you're just really soaking yourself into the moment, how the wrapper feels, how it makes that crunching noise when you put the chocolate or the raisin in your mouth. How does it feel? How is the texture? Is it hard? Is it soft? Does it melt in your mouth? So on and so forth, right? Mindful movement. So there is a whole space with meditation app, Headspace. I know for sure because I've used it in past. It offers walking meditation. So whilst you're walking, you are sort of experiencing a meditative state. And how can you be more than aware and be in the present moment? Thoughts as cloud. This is something that I encourage my clients to do as well. The reason why we spiral, especially with anxiety, is because we think that we have to chase each and every thought, right? But when you think of a thought as a cloud, clouds are not static. They don't stay in one place. They move. Right? They float along. So similarly, your thoughts should be moving from one place to other, and you should not make an attempt to catch it, but just observe it like you would observe clouds in the sky. I'm going to move on to my favorite bit of this, the humanistic therapies. Humanistic therapies are non-directive, which means that the client has gets a say in where they want to take the session, right? So you are not directing the therapy in any way. The client has the power to do that. So, humanistic therapy comes from a place where there is a lot of responsibility, onus for change for the client, right? As a therapist, all you're doing is you're being a counselor, you're being a guide, you're doing the hand holding for them. But at the end of the day, it's them who has to uh, take the responsibility, accountability, and change. Humanistic therapies also acknowledge that people have freedom, and while they're free to do things, free to think, and free to say, there is also a responsibility that comes with it. And both of these things are in their control. The whole idea of humanistic therapies come from a definition, of WHO, that health is not the absence of a disease, but you're trying to reach your fullest potential. So the goal here is to increase self-awareness and to increase self-acceptance, right? Self-awareness does not translate into clarity or acceptance, but you have to work towards both. I'm quickly going to just name the three therapies that have gained popularity here. One is the client-centered therapy by Rogers, and the belief is that the client who comes in with the problems, with concerns, with depression, anxiety, they have it in them to heal themselves. They have the capacity to make their situation better. It's on them to sort of take control, to take charge of their lives, right? As a therapist, you are only directing them. You're only reflecting back to what they have said. You're only empathizing with them. And when you create such a safe space for them, when you create an environment where they can be unabashedly, non-filter kind of a self, it gives them power to change. Because then nothing is suppressed, nothing is repressed, nothing is ignored or neglected. Gestalt therapy is a bit different than this because there's a lot of emphasis in how your body and mind works, right? So what you're experiencing in your mind is also experienced in your body, and you use your body as a sort of a signal to understand what is happening with you internally. So, for instance, if I have a headache and if I'm feeling stressful, then probably the two things are connected. Maybe I carry my stress in my shoulders, so I need to sit with it and I need to really focus on my shoulders where I'm carrying the stress. There are a lot of exercises here, and the exercises here are a lot experiential, right? The common being empty chair technique, where there are literally two empty chairs and you have these two voices in your head, and you sit in one chair and you let that one voice flow, and then you sit in the other chair and you let the other voice flow. By doing this, you're bringing both of them into your awareness, and then you're better able to understand that both of the things can coexist, or if one thing needs to be let go of. Existential therapy is something that I personally have a huge stake in. And what existential therapy does is that it understands that that the whole purpose, the whole point of life is to is to do something, right, or is to be something. So it attempts to cope with issues of meaninglessness, isolation, death anxiety, and freedom. Meaninglessness, people come in with a lot of questions, who am I, what am I doing here, is this even worth it, what's the point of it all. The questions of existentialism or existential threat have become so real in last 1 year. But it also deals with isolation. The idea that even though you are surrounded by people, you have a partner who is absolutely brilliant and loving and caring, or you have parents and family who loves you to death, there are going to be moments when you're going to be on your own, when you're going to feel that loneliness. Like they say, we are born on our own and we die on our own, right? So how do we come to terms with that, and how do we learn to then deal with that isolation in a healthier manner? Death anxiety is sort of bringing the awareness of death into the room and speaking about it. We are all aware of our morality, but we don't make an effort to acknowledge it. And when you start acknowledging your morality, that you have finite time and finite possibilities exist for you, you start to make decisions based on what's important and say not on what is expected of you. And of course, all of this ties with freedom, that I have to work in my boundaries, I have to work in my limitations. But is there a chance, is there a possibility that I can probably create my own structure? Is there a possibility that I can stretch those boundaries? That's what it's all about, again, in a nutshell. Narrative therapy is something that works brilliantly with the population, with the population that is children or adolescents, but also young adults extensively. Why I'm talking about this is because storytelling is one of the ways in which we express ourselves. Storytelling is the way in which we give meaning to what has happened, right? Even when you're narrating something that has happened at work, or that is happening in your family, you are storytelling in a way. And when a person comes into therapy, when you link these major events, right, in a chronological order, you sort of start making sense of how all of these stories have shaped that person, how the person got here, right? And what narrative therapy does extensively is looking beyond those few events, and looking at the periphery, looking at what is happening around those events, and just making the client comfortable that this is just not your story. Your story are also these smaller dots on your canvas. And when the client is able to do that, the client is able to rewrite or restructure whatever has happened with them. So, for instance, when a client comes with a problem structure, that everything in life is problematic, narrative therapy enables that person to look beyond those problem stories and look what has enabled them to come to this place that they are. Interpersonal therapy, the goal is to focus on the client's interpersonal relationship. All of us agree that if there is something wrong with a significant relationship in our life, is going to impact us. So what we do in IPT is basically understand what it is that is going wrong in a significant relationship, and how we can change it to sort of then have a ripple effect back and then reduce our distress. We try to identify individual problems in terms of interpersonal relationships, and then the interpersonal relationship is then addressed. This model was specifically developed for depression, but now it's used to treat a wide variety of clinical conditions. So one thing that we do in IPT is do a communication analysis, right? Where is it that the communication is sort of going wrong, and what
Hi,
can we do to.
Mrunmayi. Sorry to interrupt. While you made some amazing points so far, we're running out of time and we'd like to ask you a few
I just
questions.
have one last
Yes,
bit to
sure.
address, and I'm done. Like that's it. Just
Yep,
give me
continue.
1 minute. Yeah. Yeah, art-based therapy. This is something that works amazingly. I have had a chance to do a workshop on it, and personally, and also in the group, I could see that how when you make use of art or any creative process, it improves a person's well-being, overall well-being, right? But it's just not enough that you make an art, but you also reflect on it, right? You also reflect on what has happened with the art product, what was your process while you were doing that art. It increases self-awareness immensely. It helps to sort of put forth what is happening with me without the need for any verbalizations, or without or as limited verbalization as it can be. And with children, with adolescents, it's a huge way to break that barrier. And like I said, although art is for everyone, it works brilliantly with children. They're a lot more expressive, and sometimes they don't have the vocabulary, they don't have the language to say what is happening. So play therapy, art therapy is something that works wonders with them. And I think I am at the end, so I'm just quickly going to stop my screen share, and we can go ahead with the questions.
So first of all, that was an amazing panel. So we have a few questions we wanted to ask you. So with the
Sure.
rising cases worldwide due to this pandemic, how do you think this has affected people's access to therapy?
Hmm. I think there are two ways to look at this. One is because everything went online, because everything went on Zoom, it made people able to approach therapists, psychiatrists, counselors that are not just in their geographical area, right? So I could get on a call with a counselor, with my therapist in Bangalore, and have a session. So that's a positive thing. Uh, Even the awareness has increased. So I, especially last in the beginning of the last year, I could see a lot of Excel sheets that were circulated around with a list of people who are offering pro bono services, people who are offering sliding scales. So there is just a lot of awareness also in terms of who is doing what. But what I see it has also done is that people who come from a place, a family environment that is toxic, maybe there's violence in the house, maybe there's just no physical space, right? You can't always have the luxury of having your own room and talking on a phone. For them, seeking therapy and then following up with therapy became a huge barrier, right? So they had to go on their terrace, find space in the parking lots, so on and so forth, which is not ideal. But we all have to do with what we can. So I see the whole thing in two through two lens.
Yes. So one question from the YouTube live stream asks, how do you deal with self-harm?
With self harm, and that is something that I am sure that I haven't mentioned in the presentation, is there are separate modules with self harm, and DBT, dialectal behavior therapy, is something that has proved very efficient in reducing self harm. Why is that? Because DBT teaches skills like emotion regulation, right? How am I regulating my emotions with the context of what is happening in my life? How do I learn to tolerate distressing emotions, right? How do I learn to tolerate that wave of pain or that anxiety? How do I better learn to tolerate uncertainty? And then I sort of learn to also have some other measures in the place with which prevents the self harm from happening. So there are various. There's a whole module in DBT, and the I think the manual is available online, so a lot of people can go and approach it. A simple thing we could start with, is how can you distract yourself when you get self harm thoughts, right?
And we have a question from Mansha. How can we reduce prejudice towards someone who wants to seek therapy?
Hmm. Um, I think that we all need to start acknowledging that it could happen to anyone. When we speak about mental illness, when we speak about mental disorders, it's just not restricted to clinical depression, anxiety, bipolar, or schizophrenia. We all undergo situations in life that can hamper our mental health, that can make us feel stressful, and that can have an impact on the various aspects in our life, right? So when we start acknowledging that it could happen, it could also happen to me, and we also start to realize if it can happen to me, it can also happen to the other people, right? Having said that, again, platforms like this that talk about it, and I would also encourage people who have gone through something like this to come and share their stories. uh, what it does, it also tells people that that someone that I'm going through this, there's treatment available, this works for me, which will also mean that it will work for you, right? Be vocal about your struggles. There's no shame in having struggle. Everyone is going through something or the other. Yeah, and again, it all comes back to education and awareness. If you don't know something, ask that person, ask the doctors with anything. Go to proper reliable resources.
So, regarding the education and awareness that you mentioned before, so far we have seen the rise of portrayal of mental health and mental illness in the media and popular culture. So, how do you think this has affected people's views towards therapy?
Um, I think it's a very interesting question because I see some movie shows depicting it brilliantly, and I shows just as much portraying it horribly. Like, I know I saw this video very recently. Someone had commented about the second season of Family Man 2 or whatever it is, how they have not portrayed therapy accurately or as accurately as it can be, right? But I also know that there are shows out there in popular media where they get some bits right. I think at the end of the day, what all of it does is that it at least puts therapy or any kind of a mental health concern or mental health awareness education in the mainstream, right? Even if I know that it's not being portrayed right, at least it's out there. At least I know people like my parents generation, they'll be able to see it. They may not understand it completely, but at least it's there out in the open, right? So it is, I would like, and I think I'm being too optimistic here, but I would take it as just like a initiation of a bigger conversation, of a bigger dialogue.
Yes, so it's good that people are raising awareness towards it. So it help to reduce that stigma, which is what we want to achieve. So Anish asked, how does CBT help a person undergoing bipolar disorder?
Oh, that's a very specific question. I think for that you have to evaluate the person. You have to understand the severity. The first line of treatment for bipolar is always medications, and once the person has stabilized, then you can work towards rehabilitation. And how does CBT work? CBT works in terms of the shame, guilt that the person is feeling. A lot of people who have experienced bipolar disorder do report this, right? That they do things when they're out of control, and then there's a lot of shame and guilt associated with it. CBT also has a huge component of psychoeducation. Just psychoeducating about the illness, signs out to watch out for, what can they do when they feel like things are just beginning to get out of control, right? How do we maintain a routine? How do we maintain our sleeping habits? All of these comes there. There's a whole different book manual for CBT pertaining to treating bipolar disorder. Yeah, but the first line of treatment will always be medications.
So going back to the topic of media and popular culture, there have been shows such as 13 Reasons Why, which have talked about serious topics such as suicide and self-harm. So while it has brought on the conversation about how we should react towards it, it's also been somewhat problematic due towards its a glamorization of suicide. So what is your opinion on it?
Well, full disclaimer, I haven't seen the show completely. For some reason, I just couldn't stand it. But what I would say here is that, of course, it is problematic, and I have read enough to know that it is problematic. People have not been happy with how they have portrayed things because, like you said, it's glorification and it's also normalizing this behavior to an extent, right? Having said that, it is also an opportunity to talk about these things, right? When you see that there is something that's not done right, what you do is you basically say that, okay, hey, this is not how it should be. If this, you need to also look at these things, right? Again, like I said, this is all like a starting point for a bigger conversation. And considering this, I don't think it is going to be possible to make a show that involves therapy, mental health, in just 100% correctly, because the experience of it is so different for different people, right? So I may relate to something from it, but the other person may not. Other person may find that this is not what depression looked like for me, or this is not how my anxiety looks like, right? So the experiences of how it is felt is also very different, and we need to sort of take those things into consideration. But I would take it as a starting point for a bigger conversation.
Yes, that was very insightful. So, usually there are some people who usually downplay when somebody is going through something. Like, for example, when you have like serious mental health issues, people usually think you're acting
Hmm.
like you want it for attention. So,
Yeah.
what do people do in that case?
If you're thinking that someone is having a mental health concern and you think that the person is doing so, acting up for attention, maybe a good place to start is to ask, why is that person seeking attention? Right? What is it that is making them seek attention? And if you have to think about logically, if I'm seeking attention, would I, and if I'm not going through anything, why would I portray myself as if I'm going through depression or anxiety or anything else, right? Uh, I would probably do something on the other end of the spectrum to get that attention. So that could be a good starting point. The second thing I would want to reinforce here is have a conversation with that person. Even if you think that that is what the person is doing, ask them, what is it that is happening with them. Are there any obvious distress that they're going through? Are they going through a divorce? Are they going through unemployment crisis? What is happening with them? And if you have enough evidence, then maybe you need to check your own prejudices. Maybe you need to check your own biases, and then take things forward from there.
Okay, Bianca seems to have frozen out there, so I'll just jump in. Bianca, you're back. Go ahead.
I'm so
You
sorry about that.
No, no
Please
issues.
excuse
No
me.
issues.
So we so now we have seen the rise of like support groups, and we
Hmm.
usually talk about our issues and with like-minded people who have gone through the same thing as us. So how do you think that helps to reduce the stigma towards reaching out for therapy?
I think it's a wonderful that has the thing that has happened. For one reason that I know I can personally relate to is I know that someone else out there is also going through the same thing, which means that what I'm experiencing is not abnormal. What I'm going through is not something that I need to be ashamed of, or something that it's not a reflection of myself or my identity. It's not a weakness, right? So that is what these support groups, these peer groups does. And there's also, I have seen, there's also a lot of camaraderie amongst people, the people, because they know that what they have gone through is something that's not a pleasant experience, because they also realize the barriers towards seeking treatment, people are quick, or at least people are forthcoming with any kind of help that they can offer. So if I'm putting on it on a group that, I need to go and see a therapist, I'm sure that people are going to come up with a list and recommendations, right? It's a huge support network. It's a huge support, not just in terms of where I can talk about things and vent out about things, but also when I'm looking for practical help. What I have also seen happening is when I see someone else seeking therapy, when I see someone else going to a psychiatrist and taking medicines regularly, it assures me that, what, this is something that I can do as well. This is something that maybe I should also consider doing, right? So it just builds up that confidence. It just normalizes taking treatment, going to a therapist, going to a psychiatrist. So support groups of any kind, peer groups of any kind are doing a huge job in that perspective.
That was great. So we have one final question for you.
Sure.
So, what advice would you give someone who wants to go to therapy but is hesitant to do so?
I think I would ask the person, what is it that they are hesitant about? What is it about seeking therapy that they're not comfortable with? Where are these anxieties, insecurities coming from? What are they afraid of? And if they're able to at least come up with a few pointers, right? Maybe it's about confidentiality. Maybe it's about, I don't know if I need therapy. Maybe it's about, I don't know what graves I will dig up once I go to therapy, right? So once you have an insight about whatever it is that is holding you back, talk to someone. Talk to someone, maybe on a formal basis, maybe on an informal basis, and get those doubts cleared, right? If you're going to keep Googling about this, Google will give you alternatives. It is not going to give you a decision. So you have to make a decision to, at the end of the day, see someone. Going into therapy, ask people for their qualification, ask people for their experience, ask people what they're comfortable, what kind of population they're comfortable dealing with, right? How they think they can help me as a client. So once you start clearing these doubts, clearing these um, these obstacles, maybe you will be better. I don't know, maybe you'll be better approachable, or you'll think therapy in more approachable terms. But yeah, I think the first thing I would tell them is, why are you hesitating? If you know that you need to go see someone, what is holding you back?
Oh, looks like we have one more question if you're fine with that. So
Sure,
the
sure.
members of the LGBTQ plus community are still ashamed and are called very derogative names in
Mm.
today's world. So how do we deal with this when your own peers and family do this to you when they don't want to help and understand you?
It so happened that I attended a workshop yesterday, which was directed at how do we use DBT, dialectal behavioral therapy, with this population, especially with this population, right? And one thing that came up constantly is, how do you find acceptance, self acceptance in a world that refuses to accept you? And it's a complicated question. There's no easy answer to it. Like I said, each one of the member of a queer community has very different experience. But again, I think I would start by saying that, find your people, find your tribe, build a social support network that works for you. It could look like other people in the similar support group. It could look like your friends. It could look like an extended cousin who is okay with, who is accepting of it as well, right? So start there, and reach out to a mental health professional, because I have seen it in my professional experience, in my personal experience, how this stigma and how just the kind of language that we use around such people has such a devastating impact. And when you speak about these things in therapy, I'm not saying it's going to change the world, but it's going to make you better able to reflect on those experiences, and make peace with it eventually, right? It's a process. It never works. It never goes from A to B in a straight line.
So Thank you for that. I think that concludes the end of this panel and this session. Thank you so much, Mrunmayi, for this session. It was very informative and insightful. And stay tuned for the next panel.
Thank you. Thank you so much for having me. It was wonderful. Thank you, everyone involved in the back end who have been organizing this. The process has been just seamless and smooth. So thank you. Thank you so much.